Well, good morning, everyone. On behalf of Hurley Medical Center, our Board of Managers, and the entire Hurley family, we're so pleased that you could join us here today. We're here to talk about Hurley's Teen Health Screening, Check Screening Program. The screening for teenagers ages 13 to 19 looks for evidence of hypertrophic cardiomyopathy, a serious condition that can cause sudden death in young athletes, as well as students involved in physical activity. Sudden cardiac death is the leading cause of death in young athletes. As the region's only Level 1 trauma center and children's center, we are pleased to offer this special, one-of-a-kind, in-depth experience, which will include a heart screening, medical history, blood pressure, EKG, and echocardiograms will be provided if necessary. The screening will take about 30 minutes, and those 30 minutes may save a student's life or provide that child and parents with peace of mind concerning the child's risk of sudden death from this condition. Now I'd like to introduce Dr. Mike Yagi, who is our Chief Medical Officer and also the Chief of Emergency Medicine here at Hurley. Dr. Yagi.
Thank you. Thank you for the introduction. I'm going to keep my comments fairly brief, as the next two speakers are really the two that have put everything together and put this screening together so that we can pursue our mission here in Flint, and that is service and clinical excellence. As you heard from Mr. Wardell, cardiomyopathy and sudden cardiac death in a teenage population is quite a traumatic event when it occurs. When it occurs, we typically hear about it not only statewide but nationally. It's quite traumatic to say the least, because it's completely unexpected and it happens at the most inopportune times, as you all hear from the media releases when it does happen. Without further ado, Dr. Jim Weber, again, will give you a little bit more of the science background into why we're doing what we're doing. Thank you.
Thank you and good afternoon. I think that Mike has hit on a lot of the salient points with regards to this problem. Hypertrophic cardiomyopathy occurs in approximately 1 in 500 individuals. What is a bit unique about our screening process is that it takes into account not only every kid and any kid, and by the way, we want them all, but hypertension, premature hypertension, is ubiquitous in this community. It's not something that is routinely screened for. And hypertrophic cardiomyopathy causing sudden cardiac death occurs disproportionately in African Americans, and this has historically been the very population that has been under-screened. As Mike had alluded to, the biggest argument, the adversaries to doing this, is because it is cost ineffective. It is one of those low prevalence yet very high impact issues that we confront. I can assure you I have had the misfortune of having to have dealt with this very issue 4 times in my career. There's not a price tag that you can put on the look on a mother's face when you have to tell them that their 17-year-old kid has died and that perhaps there was something that could have been done to prevent it had it been identified preemptively. So with that being said, we're very proud that we're really launching into a community that routinely wouldn't be screened. And if I could say a word to the public about why we're doing this is not something that is part of a routine history and physical. So the typical athletic physical that your child would get will not cover this. The typical physical in a pediatrician's office, for example, would not routinely screen for this. And we have very good data from the American Heart Association and the American Academy of Pediatrics that the guidelines that are currently established are not routinely followed. So what we're trying to do is use this venue as a template to launch to develop infrastructure, if you will, to continue this on an ongoing basis as part of our mission with regards to public health and community outreach, and being the thought leaders with regards to the science behind this, see what evolves and what we can contribute to the scientific community as well. So with that, I think I'll turn the microphone over to Scott Bonsheim, who will say a few words. Scott and Kim Bonsheim have deeply seated ties to Beaumont Hospital, and really I can't take credit for this. This is Scott Bonsheim's vision. I had the privilege and the blessing to be able to help push it through. It's been a 7-month labor of love, so I'd like to turn it over to him to have a few words with you.
Thanks, Dr. Weber. Yeah, we're very excited about this. This is something, as you can see, we've been working on for a long time. We anticipate, we're hoping to have at least 200 teenagers come for the event. It's going to take between 45 minutes and an hour for each of the students to go through the screening process. There will be children, a percentage of the children will have echocardiograms as well. And if we identify anything abnormal, anything that will change what this student athlete should do regarding exercise, then we will sit down with the parents, go over the results, and also discuss the information with the primary physician. So none of this information is going to get lost. We're going to continue to follow up with this. And again, it's something where it's an important issue. We need to identify these kids if there's problems that could potentially occur. So again, we encourage everybody to sign up for this, and it's going to be a really great event.